Good afternoon, you're welcome to Press Center. Press Center is a public affairs program on Quest Radio Television in Sabah every Wednesday. On today's Press Center, we're going to be looking at a very, very important discussion that we have not actually thrown light into because our politics and other issues of governance have taken away certain areas that we need to dwell on. And today we're driving towards the health sector. Most times people go to hospitals without diagnosis of ailments. Certain times they patronize roadside medical practitioners, pharmacists, and even chemists. I don't know. But then, for you to have a proper evaluation of illness, you definitely must have a diagnosis. And to do that diagnosis, members of the medical field, the medical profession, who have been so trained to carry out diagnostics on behalf of medical doctors who interpret the proclamation or the evaluation statistics put forward by these medical lab scientists. And to throw more light on that, I have one of such icons in that field right here with me in the studio. Today, we're going to be looking at the role of medical diagnostics in evaluation in the practice of medicine. And I have with me in the studio Michael Isiche. You're welcome to Press Center.
Thank you, Honorable Dr. Meshakoza.
Yes, always a pleasure. And you've been with me on programs before now.
Yes, yes.
Today, normally there's been so much discussion on politics, discussion on the issues of governance, National Assembly, corruption, but then nobody has looked at an area. I was moved to come up with this topic today, and the issues are because I've been a victim, and of course not just a victim, and I followed the process of medical diagnostics and evaluation. And most times a lot of people have been victims of wrong diagnosis that has led to wrong interpretation by the medical professionals, medical doctors per se, and wrong administration of treatment. Now, what is your understanding of medical diagnosis?
Thank you very much. I'm glad to be on this station today. Thank you for this very important thing because of late we have been trying to throw more light on the importance of medical diagnosis. And some days back I had a discussion with someone, and the person was sick and he wanted me to just tell me the drugs that I would take. I say, how do I tell you the drug you're going to take when I don't know what is wrong with you? You have to go see a doctor. The doctor will make some prescribed tests for you that you will run, and from there we will know what is wrong with you. And all in his mind or her mind was that she was having malaria or typhoid, and that is the general norm in this part of the world. So the first thing that comes to the mind of someone is that I have malaria or typhoid whenever I'm feverish. But lo and behold, I insisted, and she came and got to us in the clinic, and they prescribed it. And the doctor, when the doctor listened to her, he said, "No, I'm going to add pregnancy test." I went, "Oh no, I just saw my period some days ago, and months like I'm expecting it next week. Don't worry, go and run some tests." And lo and behold, it was pregnancy.
Wow! So
by the time we did the test, the malaria was very scanty, and there was no typhoid. Pregnancy positive. And I told her, if peradventure you are going to take drugs it will have affected your embryo. It will have affected the pregnancy state that you are. So you can see the importance of diagnosis. Many persons have lost pregnancies. I remember one in particular when I was in Akukwibu. The woman had been married for 3 years, and took drugs for malaria only to notice that she started bleeding, and she didn't know why. Why am I bleeding? Because she didn't know she was pregnant, and this was a child that she had been expecting for 3 years. She rolled and rolled on the ground that they cried. I said, so arbitrary treating of yourself, in this era that we are of diagnosis, is totally out of it. No matter what you see as maybe the waste of, some people will say, I'm wasting money, let me go and buy drug. All fever, all ailments are not malaria, typhoid. In fact, I can tell you vividly, for the past 1 month, I have not even seen anybody that has typhoid in my diagnosis. So why is it that people just arbitrarily take antibiotics when the typhoid is not there?
So looking at it critically, because it's a norm amongst especially Nigerians that at the slightest unwellness they feel in their body, they just go to the next available chemist shop and say, give me mix painkillers for me. Or they go there, do you have malaria medicine, without proper diagnosis. So
I think it's a failure of the system.
Yes.
Everybody wants to sell drugs now because it's a very lucrative business, and a lot of things are going on. I can tell you without missing words that the drug resistance we have in Africa today is because of this arbitrary usage of drugs and abuse of drugs, abuse of the use of drugs. You go to a chemist and say, mix me drug, and it takes one of paracetamol.
And the other thing, the person mixing this drug is not even educated.
No, it's not.
They just let. It's like a trade now.
Yes, it's a trade. Good. You just got in what? It's not a business.
A business. Somebody learns the business for 6 years and starts mixing
6 months. They are done with learning and they just want to make money. They are not after your health.
Professional.
Because for those of us who went to school, we swear an oath. There is, in doing your induction, you are made to swear an oath. Your primary objective is to save life. And any other thing you do contrary to that oath, you are like committing a great offense to God and nature. Because your primary objective, that is why if you go to a well-trained and a pharmacist who have good conscience, he will even tell you, I can't give you this drug.
Straight.
But someone who is after business after money, if you tell the person, give me ceftriaxone 20, he will give to you.
Give me tramadol, please.
He will give to you, irrespective of what he's going to do to you. It's not concerned as far as he makes his money.
Yes, you seem to be making a lot of sense.
Yes.
Because I've been in situations where I needed to get tramadol for my condition.
Yes.
And the next question they asked me, do you have a doctor's prescription?
Good.
If you want to buy Lexotan, do you have a doctor's prescription?
Good.
Now, what is the relationship between the working relationship between medical lab scientists and medical doctors? How influential is the job of a medical lab scientist in the discharge of medical responsibilities by medical personnel?
The relationship is cordial, and it ought to be very cordial. Let me use the word ought to be very cordial. Just that, certain times you do have this interprofessional rivalry or issues, but the persons who understand, everybody knows their place. The medical field is like everybody has like a division of labor, specialization. You have those who are the doctors at the head. Okay, they are the ones the patient come to make the complaints to, and they know where to send you to. You go here, go and run your test, and from our test results, they are able to tell you. If I can tell you vividly that 60-70% of treatments in the hospital right now are diagnostic based, either core medical lab or radiographic, radiographers, and sonographers scan and X-ray. So they get to know what is really wrong with you. And so that's why when you go to a specialized hospital, they don't just trust to prescribe drug for you. They'll say go and run some tests. And once the test result comes out, no matter how many days it is, the test result comes out, they are able to know between the things they have ruled out and what they have on ground, what exactly to treat you with. And you start from there. So the relationship is that of professional relationship, where there's a chain reaction, there's a chain of events, and the person who gets the documentation at the end sends you to the pharmacy, go obtain some drugs. If there is need for you to do vitals, you say go meet the nurse, let the nurse check your BP and the rest of them. Then after that, there's a scan, go and meet the radiographer. So that is the coordination that he does, and from the analysis he gets, is able to put you in a good stead.
Now let's look at the role of the patient. Most times, because of the medical history that I've had, and I've had the privilege of interfacing with a lot of medical personnel. My treatment started from your clinic, and when you did the clinical analysis, it was observed that what we were thinking was not. Then I requested for abdominal CT scan.
Yes.
Now, in the course of my treatment, what I observed was this: 90% of Nigerians do not want to go to do evaluations and diagnosis. And early detection is key.
Very, very key. Very, very key.
That was what I was told by the doctors. That the reason you are alive today is because of early detection.
Yes.
Now, what is the role of the medical lab scientist in helping? Because I think as a medical lab scientist, your advocacy should be information, enlightenment, and education. Nigerians are underinformed about your responsibility. How can you improve on that?
Thank you very much. Of late, we've been having this discourse, and I think I was in one of your sister broadcasting house for 2 consecutive weeks, and they've seen the need that there is a lot of information to be given out there. There's a lot to be told, to be said, and we also have the conscientization that there is need for us to constantly be on air, both on social media, on print media, to enlighten our people and make them aware. What you said is very crucial. Many people tend to leave out this early detection thing you are talking about. I always said, there was a guy I said, have you done your prostate test as a 40-year-old guy? Because as at that stage, you are supposed, he said, no, I'm not old enough, I should, But I said, just try it. I will do the screening for you. It's cheaper than the quantitative. Yeah. And if you have this, we will now step you up. And lo and behold, it was positive. Because he was assuming that it's when I get to 60 I start checking. We are even having a situation where 2 days ago I had somebody in my diagnostic center that had 2+ sugar, a young boy of 21 years. So some of these things are coming much earlier than we ought to. Before. And with just simple analysis of maybe urinalysis or food blood count, you are able to get to see some of these things. I can tell you a lot of these cancers that kill a lot of people today, if someone had been able to see it in time, whether leukemia or the rest of them, do a proper analysis, maybe go and do HPV for a woman or do some breast check, they will observe these things very early and be able to cut it before it takes their life. So very, very important. And we owe them, we want to admonish patients, our citizens, to not to see laboratory investigation or checking about themselves. I tell people, you routinely go and check you routinely go and check your vehicles. Your bank account, you do servicing of vehicles. Service your body. Once in a while, go to the hospital. Tell them I want to check myself. I want to, and you may not, because like I tell people, there are simple tests. Yes, there are simple tests like urinalysis for one. The highest you can get is not more than 3,000 naira. Yeah. In some places 1,000, maybe government hospitals. But that little test can show you a lot about yourself. Then you can also do full blood count. It also gives you a lot. Then for those of us who have crossed the other side, like beyond 40, do your organ test now once or twice in a year. I do that myself. I go to Federal Medical Center, I meet my colleagues there, and they cross-check me. Ethically, we are not advised to check yourself, because somehow you can be biased. When you are looking at this white, you say, no, it can't be white. I will say, okay, I'm okay. Yeah. When you know you are not. So you go to someone else, they check you. And I do it periodically, once or twice in the year. They run my test, my liver, my kidney function test, my heart function test. I check my cholesterol, I check my prostate. And if there is any abnormality, whatever it is, I start trashing it immediately. And that helps you. So it's not a waste of fun, because what people don't know, what people don't know is that little prevention you could have done very early, if you don't do it, you are going to spend more in repair and cure.
Yes, you're going to spend more in repair and care. That's the situation we're finding ourselves right now. If you're just joining us, this Press Center, a public affairs program on Quest Television, Asaba. Today, we looked at the role of medical lab scientists in medical diagnostics and evaluation. And that is, I've had with me in the studio, Mr. Dr. Michael Isichi, and a medical lab scientist who has given us an expose on the role of medical lab scientists in relation to helping the medical professionals perform better in the discharge of their duties.